Welcome to Em.Powercoaching. Discover how to reinvent yourself, find self-empowerment, and live a more positive and fulfilling lifestyle. Em.Powercoaching combines mental and physical fitness to help you connect the dots to unveil a more confident, energized, and empowered version of you. So, if you're ready, let's get into today's episode. Alright guys, welcome to today's show. It is currently Mental Health Awareness Week 2020, and so I have decided to dedicate a few of the podcasts towards raising awareness around mental health topics. So today I am joined by my friend Izzy, who is a clinical team leader, and we are going to be discussing schizophrenia. So we're going to start off by introducing Izzy, and she's going to let us know a little bit more about herself and her experience and expertise within schizophrenia. So hi Izzy.
Hello.
Hello.
How are you doing?
Good, thank you. Could you just sort of give the listeners a bit of an idea of who you are and what your experience is within the schizophrenia field?
Yeah, so obviously my name's Izzy. I am a clinical team leader, registered mental health nurse, and I currently work at a hospital in Bradford, and it's what we call a PQ ward, which is a sort of acronym for psychiatric intensive care unit. Everybody that's on the unit are detained under the Mental Health Act, and the ward is set up really for people with mental health difficulties, and generally speaking, I'd say 95% of them are diagnosed with schizophrenia alongside other conditions usually. The idea of the ward really is it's a type of ward which is a short admission. So it's designed for stabilising people's mental health problems and moving them on to a step-down hospital, which is usually an acute ward. Generally speaking, the risks are higher on an intensive care unit, so the staff numbers are higher as well, because they're kind of at a stage in their illness where they're quite high risk. So they need a period of treatment in hospital just to protect themselves and others, really. So that's generally what I do on the ward at the minute.
Wow, that's quite a handful, isn't it? That just going back to, I think you said 95% of people within the ward experience. That's such a high number. That kind of shocked me a little bit, actually.
Yeah.
So
I don't know the reasons for that. I mean, I've worked on acute ward, which is the step down from my ward now. On an acute ward, you generally get more of a mixture. So you do get people with schizophrenia on an acute ward, but you also get people with mood disorders, depression, anxiety. And just on the basis of what I know, I think with schizophrenia, it tends to be an illness which is quite debilitating for people. So generally in the community, when they're at their most unwell, they do stand out more than other maybe disorders that I see. Mm-hmm. And the risks are probably higher with schizophrenia when they're very unwell. That's how I tend to observe it. They put themselves at risk, and there's a lot of other risks associated. So I think they end up on the reason why there's more on a PQ ward is just because of the sort of debilitating illness that it can be. It's quite a serious illness.
Yeah.
So obviously I'm not a doctor, but that's sort of my observation of it. It does affect them quite a bit, and often they can put themselves at quite a lot of risk in the community when they're not themselves and they're not well, so they tend to be picked up by services and put on wards.
So the PQ ward is really for the higher risk individuals. So I mean, how does a person come about having schizophrenia? So is it genetic, or can it be a result of someone's actions?
I would say it's a combination. It's quite unique to the person. So they do say that people with schizophrenia, you are more likely to be diagnosed with schizophrenia if a direct family member have it. So you're definitely more at risk of having it genetically. But they do talk a lot about stress being a sort of driver. So stress can often contribute to that schizophrenia being at the forefront. So someone obviously with schizophrenia within the family, and then they may be faced with a lot of stress, can also contribute to that person becoming unwell. Substances as well. You often see people with schizophrenia, they've they're sort of engaging or have engaged in illicit drugs, and that can sort of manifest and sort of increase the risk of schizophrenia. So I think there's a mixture, which is why the treatment is to be as early on, and the treatment sort of engages in a number of therapies as well as medication, because they say that, you know, there's lots of different contributing factors, which depends on, you know, whether they do or don't have schizophrenia, I would say.
Do you know what's really kind of jumped out at me there is, I'll be honest, I thought that schizophrenia was more along the roots of substance abuse and sort of like a resulting factor of substance abuse. But when you mentioned there that it could also be caused by stress as well. Mm-hmm. And that's really jumped out to me, because really, like, anyone can get schizophrenia then, mm-hmm. really. I mean, if you're sort of living a very high stressful lifestyle and you're not taking care of yourself mentally and pushing yourself through stress, you know, is there then a chance that you could potentially result in having schizophrenia from those high levels of stress on a daily basis?
Yeah, I mean, I think that people would say you can't really rule anything out.
Yeah.
I think the majority of people that I see, just from my observation, is that people who have got schizophrenia, that you do tend to find a family link. So mm-hmm. I think you become, I suppose you become more sensitive to having schizophrenia if your family within it, and then on top of that, if you're going through a lot of traumatic stress throughout your life, especially from an early age, that again will, increase your chances of becoming, schizophrenia. And then on top of that, if you're stressed, a lot of people tend to cope in negative ways, so they might take drugs or they might drink alcohol, which then adds to the increase that you're going to become unwell with schizophrenia. But mm-hmm. I think it's a combination. I definitely think the genetics has got a large part to play. They talk a lot about dopamine, the hormone dopamine. They say there's a sort of theory about schizophrenia that schizophrenia is led by high levels of dopamine. So from a genetical perspective, there's definitely a part to play there. So a lot of the medication that we give them is related to dopamine levels, and it's bringing them dopamine levels down. But, like any illness in mental health, stress has got a big driver for a lot of illnesses. So mm-hmm. stress definitely have got a part to play, and you often find the two are linked. So if someone's going through a particularly stressful time in their life, that tends to be when they relapse. And schizophrenia is very much a long-term illness. People can recover from it, but it does tend to be sort of a chronic, enduring illness. So stress has got a really important part to play in that person's life, really.
Wow. So, it just highlights even more the importance of really looking after your mental health and taking time out and really finding that work-life balance, because that could be what prevents a person from ever getting schizophrenia. So that's like quite powerful stuff there. I think, and I don't know if it's the media or if it's sort of come through films, but I think a person who is labelled as a schizophrenic is mm-hmm. quite often has a certain way about them, or a certain look, let's say, especially in like films, for example. Yeah. But definitely, tell me if I'm wrong here, but I think it's just sort of what I've learned from watching certain films, that the schizophrenic mm-hmm. type character doesn't tend to be sort of like very well dressed, crazy hair, and has that sort of way about them. But, it could be that it's just a well-dressed, high professional who, is working as, let's say, a CEO job of a company and is very highly stressed and, has a lot to deal with on the plate. And, they don't necessarily look like a crazy person, mm-hmm. quote unquote, but they have developed schizophrenia because of the type of stresses in their life. So mm-hmm. I think what I'm trying to say is that I think people with schizophrenia are labelled and classed as being a certain type of person and have a certain look, whereas really that's kind of BS, isn't it?
Yeah, it's a tricky one, really, because I think if you look at the symptoms, for example, of schizophrenia, people's, misconceptions are probably fed from that, because a lot of the symptoms that you do see will relate to poor self-care. They will relate to people, not looking after themselves. That is a major symptom of schizophrenia, of that illness. So in some respects, it's not all wrong,
Yeah.
If you went onto my ward, for example, the majority of them are quite unkempt. They're not looking after themselves. They need a lot of support.
Yeah.
But that's obviously when they're at a period of their time when they're not well, they're not taking medication, they're not receiving support that they need. So, but if you compare it to someone who was maybe on discharge, you'd say you certainly wouldn't look at them and say they're the crazy ones. They can become very well, and they revert back to someone who's highly functioning. And it's just, I suppose, the stigma around schizophrenia is that they're these crazy, unloose people that go out and do crazy things. And when people are unwell, they can present like that. But just like any illness, you're not yourself when you're depressed, or any other illness you can attach it to. I think with schizophrenia, because it is an enduring illness, it's not something, it's something long term, and I think it does impact significantly on someone's life. So when they are unwell, they do stand out, and they do need a lot of support. But I do think, you hear these terms like you mentioned, schizo or psycho and all this sort of thing. With schizophrenia, you are at a point in your life where it's a loss of reality, so you act in unusual ways, and that probably gets a lot of stigma attached to it. But yeah, I do think people have got a misconception of what schizophrenia is, but it is, that doesn't take away the fact that it is a serious illness, and people do become very unwell and stand out in society, really.
Right. And I mean, that's the purpose of this chat today, really, is to raise awareness and to try and sort of diminish some of those misconceptions that people may have around schizophrenia. So what are some of the typical symptoms, or what does it sort of look and feel like for a person with schizophrenia? Like what are the type of common symptoms that someone with schizophrenia would be facing?
So schizophrenia with regards to symptoms is split into negative symptoms, they call it, and positive symptoms. So I'll start off with negative symptoms. Negative symptoms are related to symptoms which are quite synonymous with depression. So you're looking at things like lack of motivation, low mood, anxiety, social withdrawal, and they're the sort of symptoms that you tend to, I mean, this is very generalized, everyone's different, but when you're developing schizophrenia, they do say that you tend to exhibit them signs earlier. So they're the sort of symptoms that you'll show early on in the illness, whether that be sort of late teens, early 20s, or maybe later on in life. But as your schizophrenia is developing, they do say that the negative symptoms tend to show first. So often people can misconceive that to be depression or anxiety, and they tend to sort of withdraw themselves. They don't look after themselves. So they're very low, they keep themselves to themselves, they isolate themselves a lot. And then you kind of have and then you've got these periods of the positive symptoms that come out. So the positive symptoms are to do with, paranoia. They call it thought disorder. So people start, their chain of thoughts are different to other people's. They start thinking different things. Their speech might be different. They might not be able to understand this. They call it, it's no longer coherent. So their thoughts are kind of all over the place. They might jump from place to place, and it comes out in a sort of incoherent manner. And obviously, a lot of people will know hallucinations. That's probably the most common symptom that the sort of people that are not aware of schizophrenia as much will know about. So you're looking at sort of auditory hallucinations, which is when you're hearing things. A lot of common one is voices. They're hearing things that the not everyday person, I want to say normal then, but you know what I mean.
Yeah.
The everyday person would not normally hear, or you've got visual, so you're seeing things that aren't actually there. Tactile, so you're feeling things on the body that aren't normally there. And they're your positive symptoms. So you can become very distressed by them, and that tends to be when people start to notice unusual behaviours a lot more, because they're out and about, maybe a bit more responding to things. other people tend to notice that they're acting strange, or they're very suspicious and they're very paranoid and they think things are happening that's not happening. So you've kind of got this kind of combination of the positive and the negative. And the positive symptoms tend to be the ones, like I say, that stand out more. So they'll start acting unusually. They might, be going out and about, thinking other people are talking about them, and then they become agitated and aggressive as a result of that. And that tends to be when I tend to, personally as a nurse, that tends to be the symptoms that I see. Mm-hmm. But alongside that, you've still got these negative symptoms that are also playing a part, because if you're paranoid and you think everyone's out to get you, then you're going to withdraw yourself. So you've got a combination of these two types of symptoms that sort of come in episodes, they say, and they relapse and remit. So that's generally speaking the symptoms, but there's a range of symptoms that come into play depending on the person. A lot of the things people talk about, a lot of the themes people talk about are to do with electronics. So they tend to think that, people on TV are sort of specifically talking to them, or the radio's talking to them, or they can put ideas in other people's heads, or they can read other people's minds. It's just a combination of symptoms really, depending on the person. And I've kind of got this feeling that they tend to come from somewhere. So it might be that this idea has been picked up a few years ago. I don't know if this is just based on sort of things I notice. If someone's got a preoccupation generally with something, then that tends to manifest in their symptoms. So if they're, for example, like really into gaming, or their general activity is gaming, that when they become unwell, they tend to have a lot of explicit paranoid ideas about gaming. So they might think that people are out to get them through the games, or that people are talking to them through the games and things like that. Wow. So that's kind of a general. It's difficult to really. They have obviously got a list of symptoms. So if you read on any sort of NHS or national guidance, they tend to explicitly talk about different symptoms, but everybody's different. When I see people come onto my wards, they display in lots of different ways, really.
So to be diagnosed with schizophrenia, would there need to be a presence of both of those two, so the negative and the positive? Because the negative symptoms like the depression, etc., sound like they could quite easily transfer into other mental health disorders, such as depression, anxiety, bipolar even. So to be actually diagnosed with schizophrenia, would a person have a presence of both of those two, the negative and the positive symptoms?
Yeah, generally speaking, yeah. Okay. I think they do have I'm obviously not a doctor, so I don't diagnose, but they will have a set criteria regarding symptoms and signs that you have to meet to be diagnosed with schizophrenia. And I suppose it's about kind of tracing back how people have presented, talking to other people about it. Generally they say the negative symptoms will surface first, so it might be a case of finding out how they were before they came into hospital, just for example. We're trying to get a bit of background about how they've been presenting. Generally speaking, the positive symptoms are definitely the more indicators of schizophrenia, but it's not to say you could have schizophrenia and then a secondary diagnosis of depression or anxiety. They can, you can get that attachment added, so you might be more inclined to display the more sort of low mood and depression. It is very individual to the person, but the majority of the people that you see with schizophrenia, they have had experiences of hallucinations or delusions, thought disorder, all that sort of thing plays a part really, and that's when the medication comes in with regards to trying to treat them, really.
It really does sound quite complex trying to understand it and to know whether a person has it or not. But I suppose the initial symptoms and signs could be very much related to the negative thoughts and the depression, and it that could well be the starting point. And it goes without saying, for anything, that really, if you're finding yourself at that point in life where you are extremely low, you're feeling very depressed and down, and you're not able to live your life as normal, quote unquote, as your typical everyday life would be, then that's really a sign that something needs to change, and that you really do need to maybe take some time out or really think about your work life balance and have a look at your stresses in life, whether you're going down the schizophrenia route or not. I mean, if you're seeing those symptoms, it's so important to work on them at that point. The things that you were saying before, they sound awful, they sound so scary, especially when you're talking about, for example, someone who's really into playing games, and they think that the characters on the screen have got it out for them, and that certain people are talking to them and negative things are aimed at them. That must be really scary to live with. I mean, how does schizophrenia affect someone's life? Because it must have a huge impact on the social life, on the work life, everything. I mean, what kind of things have you seen where it's like really affected a person?
Yeah, no, you're right. Majority of people who I see, obviously I work on an intensive care unit, so I'm kind of with that individual. They're at that point where they're having to be detained against the will. They're often taken from the home, or they're taken from a place of safety. Police often will pick them up because they've been acting, in a behaviour that's putting themselves or others at risk. So, it is very distressing, and often, we're human beings, we're out and about, I think the difficulty I find with schizophrenia, when they're that unwell, they don't really acknowledge that they're unwell. And that's a barrier for me as a nurse to try and get that person well again, because they don't want to take medication. They haven't got the insight at that time to acknowledge that they might be displaying paranoia. They're very distressed. They become quite aggressive, and I think it becomes a scenario of me against them, really, especially because they can become very aggressive. That they're so distressed, they don't see that they're that they're maybe relapsing in that stage of their life, and on the ward they're not interacting well with others because they don't trust anybody. They must be in a state of mind where they just don't want to speak to anybody, and then when you're trying to engage in with them, they can become very dismissive and very aggressive, and it's hard to build that relationship up with them as a professional. So I can only imagine in the community when they are at home, it's exactly the same. Family are probably struggling to sort of engage with them, and they don't want the help. They don't think there's anything wrong with them, and it can be quite a chaotic lifestyle. I don't actually know anyone personally, thankfully, with schizophrenia, but from a professional aspect, I see their functioning at that time is extremely low. They're not looking after themselves. They're not showering. Some people, they won't shower because they don't think it's safe. They won't eat because it can affect your taste buds, for example. So, some people think that you're poisoning them. That's quite a common symptom. They think that the food or the medication is poison, and that people are out to get them, so they're not going to eat. Or the food doesn't taste right. It affects all your senses, so they don't eat because of that. And then it turmoil into sort of not looking after their diet and the physical health. Physical health's a big one with schizophrenia, just because of the way symptoms manifest. It affects the way that the motivation. They don't want to exercise. They want to be in the room where they feel safe. They don't want to eat. They can't sleep. It impacts them in a lot of ways, really. And it's finding that. I think for me as a nurse, it's finding that trust. So at a point when they're so unwell, you have to be really careful, because they're in that state of mind where they don't often know that they're unwell. So it's trying to sort of slowly build that trust of bringing that function back with them. And since they've got medication, within a few days you can see improvements, and then it's just finding that time to get them bit by bit better and looking after physical health and getting them back home, getting them back within the family, getting them back to work if that's the case. It is very difficult, and it's not something that can be fixed overnight. And often you'll see readmissions, so they'll go home and they're well, and then they're coming back into hospital. So it's back and forth. It's not stable. It's an illness that really does get
God, that just, it affects everything, doesn't it? Everything from your social life, your relationships, your work. I mean, everything just comes to a stop because it's impossible, right? It sounds impossible to be able to live with the condition and continue your everyday life. And so have you ever spoken to a person's family? Like, do you know how that must affect, a person's loved ones, so someone who really cares about that individual, but, would struggle to have the relationship because it's just impossible for them to have that trust that you were talking about. So that must really affect like a person's loved ones as well.
Yeah, definitely, yeah. And I think a lot of the service users that I nurse are at an age similar to me, which is quite sad really, because so often you get mum and dad tend to be the nearest relative to them. And yeah, of course you don't envisage that your child's going to be in and out of hospital, not looking after themselves. They're constantly worried. I do speak to family. It again depends on the service users. A lot of service users, sadly, don't actually have much family, or supported ones. But some people have got really worried parents. They're ringing up every day. They don't know what to do. And it also it's all about this awareness thing, isn't it? A lot of people don't realise what schizophrenia is, and that includes parents as well. They don't understand what's going on really, and they rely on us to sort of reassure them, that this person will get better. But like I said, it's not often. It's not just like they're going to be in hospital once. Unfortunately, they will have numerous admissions, and it's something that's going to happen over a number of years. So I think with family, it's just about keeping that trust. Often with families, they'll give us information on the ward about how they've been presenting in the community, but they don't want us to communicate that to the service user because they're worried that relationship will be broken down. Because at that point in time, they don't think they're unwell. They don't want to hear that the family think they're unwell because that's again someone that's against them in their view. So it's about, for family, it's about, giving them reassurance, but allowing us to sort of do a lot of the nursing, and then they can be there to look after them for the emotional support, because that person will need family, and, the family need to keep in contact with, for example, the child that's in hospital. So it is very worrying. I've had parents on the phone crying before because they're at their wits' end really. They don't know, they're worried, they don't know what to do. What can I do to be supported? I know at my work, they've got carer support. They have a weekly carer support, so family can be involved in that for advice. Sometimes it's just letting them listen to them down the phone. A lot of the time, because they just need someone to talk to about it. And there are avenues out there for family, but it's very difficult. I think, especially when they don't know the illness very well, and they've maybe not seen it before. It's quite scary, I imagine.
It's heartbreaking. I mean, I can only imagine, I'm not a parent myself yet, but I can only imagine that if it was my child, I would probably get feelings of, like, as if I was going behind my child's back, They're doing it for the right reason, because there needs to be that support there, and there needs to be that communication between, the nursing team and the family who are with the individual out in the community. But yeah, I think I would feel as if I was almost going behind my child's back, which would be a horrible feeling. But it's so important that communication is kept up, because it can really be the resulting factor in someone's recovery and speed of recovery and success in that sense. But yeah, really challenging, like really hard for loved ones as well who are living with a person with schizophrenia.
Because these people are detained against their will, so they're in hospital. Everybody on my ward is against, they're in hospital against their will, which is distressing enough for the individual and the family. And service users will often sort of, they'll beg the parents, like, get me out of here. They do not want to be in hospital. I understand that. They don't see the reasons why they're in hospital. They don't understand that they need to be in there for their own safety. And family are often caught in the middle, like you say. So, they'll ring us and say, look, I know they're unwell and they need to be in hospital, but please don't sort of say that to them, because they're worried that relationship will break down. So it's a very difficult, and you feel bad as a professional, because I haven't personally detained that person, but you're against them at that point, because they just want to go home and live their life. But from our perspective, they're in a stage of life they need treatment, so they need to get better. So it's a very difficult dynamic at that point, definitely.
Yeah. I can't even begin to imagine. What so you kind of briefly mentioned it earlier, or you touched a point on it earlier with can the psychosis be managed? Is there a way to actually manage it? So I think you mentioned a little bit about taking medication. Is that something that can manage it and sort of stop the symptoms altogether? Like, how can the psychosis actually be managed?
So from a medication perspective, the main line of treatment will be an antipsychotic. So there's a variety of antipsychotics that you can give an individual. It's a difficult answer really, because yes, they can. You do see people fully recover and go home, but the medication that they need to be on isn't something that you take for a few weeks. It's going to be something that they're going to need to take over months and years of their life to keep them well.
Wow.
If you get the illness earlier, so it's, for example, if it was their first episode of psychosis, then you've got a higher rate of recovery. So there will be individuals that can take the antipsychotic medication earlier on, and they can continue to work with the team in the community, and they might look at bringing them off it, and they might make a full recovery. But they do say that over a period of time, if you were to have numerous episodes and relapses, every time you have a relapse, it becomes more difficult to fully recover. Whether that be that you're going to be on medication for the rest of your life, or you're kind of just managing as best you can. And again, it's individual to the person. So some people will say, look, I still get voices, but they're not distressing any longer, and they're still on treatment, but they're kind of finding a way of managing. And I think it's about allowing that person to sort of find ways to manage. So you're managing with what you've got, basically. You accept that you've still got signs and symptoms, but you find you're also getting ways in which to cope with it. And that's where sort of your therapy comes in. So again, the earlier on you can get it, the better, and the better chance you've got of recovering and being able to sort of live a functional, normal life. And that's where your aspects of therapy come in. Exercise, they've got a massive part to play. These medications that we give them, they're not nice medications. Antipsychotics are one of the worst medications for side effects. So that's partly another reason why they don't want to take them. They're not nice medications for the physical health. But yeah, it's about finding that balance, I suppose. And so yes, they can can be treated, and yes, they can recover. But like I say, people will relapse often, and you're looking at sort of 20, 30 admissions sometimes across a lifespan, and that each time you relapse becomes harder and harder to sort of recover. So it's very tricky.
Yeah, definitely. I mean, and that was one of the questions I was going to ask was, if you are diagnosed with schizophrenia, is that a life thing? Is that then you for life? I'm schizophrenic, or can it just be a period in your life and then you recover from it and you never see it again? I mean, is that a possibility, or is it a kind of a lifelong illness?
No, I think it is a possibility. Like I said, there's a team specifically for people who have experienced periods of psychosis. So I think it's from the age of 15 to 24 or 25. There's a community team that is specifically for people with earlier experiences of psychosis, and they work. NHS have funded a lot of money into this particular team with the idea that the earlier you intervene, the better the outcome.
Mm-hmm.
So if you can get that person to be engaged with therapies and coping strategies and medication earlier on, then your likelihood of recovering that later down the line is a lot higher. And there are people that will come off the medication and may not experience another relapse again.
Wow. Yeah.
But obviously, the longer you leave it, and the longer you leave it to manifest, and not manage it, and you're not seeking help, and you're going coming on and off your medications, and you're having more and more admissions to hospital, it becomes more chronic. So you'll often find 50, 60-year-olds that are sort of in and out of hospital, and it's a different presentation at 50 to 60 than you would see at sort of 18, 19, 20, because it can be a lifelong condition, and they do say it's enduring. So it really does depend on when you're intervening. It's getting in there early, really, and trying to prevent them from getting worse, really.
As with anything, I suppose, the sooner that you sort of try to tackle, is that the right word? I'm not sure. The sooner that you reach out and seek help, the better that it's going to be in the long term, isn't it? So it just goes to show how important it really is to be open about when you're experiencing possible symptoms, and to not try and just hide away and keep it a secret and keep it and aim to carry on through your everyday life as usual. And actually, if you are noticing these signs and symptoms and anything really that's a little bit out of the norm mentally, then it just shows even more the importance of why you really should seek help, or just speak to someone and let it be known. It's such a massive thing, isn't it? I mean, it really is interesting to understand and to go a little bit deeper into a person who has to live with schizophrenia. Is there sort of, so you said it can go up to, or you do find that some of your patients are in the 50s and 60s. Is there like a minimum age or a maximum age, or could a person develop schizophrenia at any point in their life?
I think they say, again, don't want to quote too much because I'm not a clinician in schizophrenia. Yeah. But I think they say that you're more likely to manifest in the earlier signs of schizophrenia at an earlier age. So you tend to find signs and symptoms between sort of late teens and 20s, where you sort of getting the negative symptoms. You're starting to notice that they're not quite themselves, and then, like I said, talking about contributing factors, you're adding stress to that. You might be adding cannabis or drug misuse, and that's going to escalate them signs and symptoms becoming more serious. From my perspective, which is all I can talk about, you tend to see people at an earlier age being admitted to hospital, and people maybe in the later years, it's more unlikely that they're going to start experiencing their first signs and symptoms at that age. It tends to be, from what I understand, an earlier thing. So, that's probably where genetics play a part as well, because, you're more likely to develop them sort of, that sort of illness at an earlier age, which is why they obviously want to try and intervene earlier rather than later. I have seen people later in life, if they've experienced a really traumatic experience, or they've gone through a really, serious period of stress, it might lead to a period of psychosis alongside that later in your 50s and 60s. But it does tend to be something that I see earlier, sort of 20s, sort of mid-20s, personally, yeah.
I mean, I think, schizophrenia might be seen to some as a weakness of mentality, so someone who has a weak mind. But if you have to live with schizophrenia for just a short amount of time, and especially if you're managing schizophrenia throughout the majority of your life for years and years and years, to me that represents someone who is extremely strong-minded, because that is a shit ton, excuse the French, to be living with and to be managing, and to be actually getting up every single day and saying, right, come on, it's another day of this. I mean, that takes a hell of a lot of mental strength.
Absolutely.
And, so you couldn't really be far from thinking that it's a weakness, because it 100% is not.
I mean, can you imagine waking up and thinking, this, everyone's out to kill me, and that is as serious as it can get. People on my ward, they genuinely think you're out to kill them, poison them, you're stealing from them. It's a constant state of high anxiety and paranoia. And I think about myself and having anxious days where I'm feeling really on edge, or I'm feeling really oversensitive. It's like times 100, I imagine, because you genuinely fear for your life, which is why people act in ways that they wouldn't normally act in, and they tend to stand out in society, I think, because that's when you start becoming very defensive, and then you might become aggressive towards others when people are trying to help. You see that as a threat, so you're fighting for your life, really. So it's distressing to see people like that, and I can almost not even imagine feeling like that. So that's why it's even more important when I'm nursing them to try and speak to them in a way that I can build that trust over a period of time, and getting some medication in them. I mean, it's amazing the impact that can have, over a period of maybe a week or two. Like I said, on my ward, the general admission time is 2 weeks, and then they'll move on to a ward when the risks have come down. And it's just the best feeling ever seeing them, better. They're not completely well yet, but they're getting there, and it's lovely because they don't realise, I don't think at that time necessarily, that they're unwell, like I've said. So they don't acknowledge that this is a symptom of their illness, that they genuinely think that these things are happening, and I just can't even imagine what it must be like, to be honest. It must be horrific.
It's yeah. I mean, it's a lot to get your head around, and you do see it out in the community. You do see individuals when you're going about your shopping, for example, and you pass someone walking down the street and they're talking to themselves, or they're doing like some dance in the middle of the road, and people are laughing and pointing and, oh, look at that crazy person, quote unquote, if they only knew what that person was going through. They're not dancing in the street because the favorite tunes just come on in their earphones. They're probably hearing it in the head. They're not just talking to themselves because they've got no one else to talk to. They've got voices, and it's just, if they only knew what that person was going through, I'm sure it would change a lot of people's perceptions and how they actually act, and people's attitudes towards to this illness. So what can people do if someone's concerned about either themselves or a loved one who is showing signs, either late signs or early signs of schizophrenia? What can they do? Is there anywhere that you recommend that people can reach out for help and support?
I mean, there's a number of places that they can reach for. I mean, we all know times in these days, mental health services are extremely pressured at the minute. But there are a number of places they can go. So, for me, I mean, I could only think in my situation, if it were me, the first place I'd probably ring is the crisis team, which is a community mental health team within the area. I mean, I've rung them before, and you've been for a crisis team, you can ring for minutes and minutes and wait, but they are a good team, and they're there for emergencies. They work weekends in the week. There's the community mental health teams that are there for you, so when you have got an illness, you've got an allocated care coordinator in the community to look after you. But obviously that's something that you have to be allocated already. So if you were you were ongoing with your schizophrenia, you'd have someone you can go and talk to, family can go speak to. There's various family helplines within your area, so I'd be on Google and I'd be Googling as much shit as I could, really, to try and get an answer from someone and some support. Police are doing a lot more work these days. We work very closely with the police, increasingly so, really, just because of the shortages on mental health services. I think the police are taking on a sort of half role of mental health practitioners. They're picking up a lot of people, taking them to places of safety. So if concern was immediate, I'd be contacting 999 and getting them out. GPs, if you were close to your GP, I'd be contacting your GP. They can refer you for support within the crisis team or the mental health teams, and just anyone you trust, I suppose. Usually someone's got someone that they trust, that they can speak to, and then that person can do it on their behalf. So yeah, I'd say that's the main ones.
Brilliant. And what I'll do is for the listeners, I will put some links to sort of like the main helplines and websites where people can find more information. I'll put that in the podcast notes as well, so people can access that as well.
A lot of the charities as well, I'd say, like Samaritans and things like that.
Of course,
they're often trained now in managing a lot of them sort of problems. If people do distress, they can sort of guide you to the right place or do it for you. So Samaritans can often be a good place to go as well.
Awesome. This is brilliant. Look, what you do is absolutely amazing. And, if it wasn't for individuals like yourself and, mental health practitioners and the helplines and the charities, individuals living with schizophrenia, just, they wouldn't have this kind of support. And honestly, God knows what the scenario would be in that case. So, and what you do on a daily basis is not easy. I imagine it is extremely physically and mentally draining for yourself. So just thank you for doing what you do. And just I think it's amazing, and just a big sort of shout out to all of you guys that work in this area and keep on doing what you do, because you are needed.
Shout out to all my fellows.
Yeah,
it's
definitely.
Not easy.
No, I imagine. So much appreciation for that. And if anyone wants to support, you can always donate money to your local charities that help with mental health. I know Mind is quite a big one as well. I've used them before. Yeah.
Andy's Man Club local to me is amazing. I would always advocate Andy's Man Club. They've been a big rock, I think, within my Halifax area, and I know they've worked with my hospital. They've actually come in before. I think it was about 6 months ago it was self-care week. They came in and did some talks with the guys, with some of the service users, and spoke to them about what opportunities they've got with regards to getting help and stuff. So a big shout out to them as well. They're amazing.
Awesome. Yeah, so I'll add those links in there as well so people can check that out. But definitely, listeners, really do think about supporting these guys in any way that you can, whether it's volunteering, whether it's donating to the charities, whether it's just raising awareness, doing similar to what I'm doing now, or doing your own thing, anything that you can do really to support, because at the end of the day, we need to support the people who are working out there on the front lines so that they can help support the people who really do need it the most. And that's so important that we try and keep that going. So thank you so much for giving me your time today. I really appreciate it. It's been so insightful for me. I've learned so much from this, and I just really hope that other people have got something from this as well, and can share it, and try and sort of raise awareness around this subject that I really do feel like is so important. Just thank you very much for your time today. And
Happy Mental Health Awareness Week.
Yes, yeah, definitely. Be kind. Be kind. That's a good one to end on. Thank you.
Thanks, See ya.